My name is Isaias Dambe. I am the Deputy Program Manager for the Malawi National Tuberculosis Control Program here in Lilongwe, Malawi. Thank you.
Good afternoon. My name is Kuzani Mbendera. I'm a medical officer working in the National TB Control Program. I am responsible for care and treatment, and I work here in the NTP in Lilongwe, Malawi.
The Malawi National TB Control Program has been tasked to look into all matters that have got to do with tuberculosis control in Malawi. This involves ensuring that we have adequate and robust diagnostic methods for TB, and that we can procure certified drugs to treat the people and ensure that they get a cure. This is done by a contingent of health workers that are properly trained in TB control activities.
People should know that it's not a death sentence, it's a curable disease. We have the medication to cure this disease. We've had it for years. We've known how to do this for years. I would like people, as soon as they feel they have the symptoms and signs of TB, cough, fever, night sweats, weight loss, to go to their nearest health facility and go through the diagnostic process. Have a chat with a clinician and hopefully end up going through the process of diagnosis.
The biggest challenges that we face in TB control in Malawi, first of all, as health workers, we need a people that know what the signs and symptoms of TB are. And the majority of Malawians may not be in the know. So one of the biggest challenges, they go to hospital with other illnesses and forget that the signs of and symptoms of TB that they have, they can explain to the health worker. Another one, of course, are the diagnostics themselves. The diagnostics for TB in Malawi are far apart, and in some of our health facilities we do not have the facilities, so specimens must be moved from one facility to another, and that delays the diagnosis of TB. To me, these are the major factors.
The other thing I believe that makes it hard is there are populations of interest. Take, for example, miners. And in a country where mining is just starting, trying to localize where these miners are, having a register of who is a professional miner, who's an artisanal miner, and then trying to reach them to do TB screening, because mining, especially the kind of mining that produces silica, puts people at higher risk for TB. Not being able to define where these people are, or that being difficult at this point in time, is a challenge.
People have a fear for TB, and this makes them want to hide from diagnostic services, from health workers. Again, self-stigma is a big challenge in Malawi.
In 2013, we carried out a tuberculosis prevalence survey. So this was a nationwide survey trying to determine just what you're asking us, the burden of TB in the country. It gives you a national estimate. And at the time, it was estimated that the incidence, the number of new cases that you have per 100,000 was 286 per 100,000. I am glad to report that that figure has more than halved. We're now at 131 per 100,000.
Of course, the survey also showed that the burden of TB in Malawi is mainly in urban areas. We know that in these urban areas, especially in the urban poor, where people do not live in very good conditions, socioeconomically not good, TB is a big burden in them. And therefore, TB in Malawi is a disease for the poor. It could be a true statement for Malawi as well.
What is needed to end TB? this is most likely going to be a long fight. There are a number of things that need to be done. For example, we would like, our NSP asks that everyone who's stepping into a health facility, regardless of their reason, you came down for a toothache, should be screened for TB. This involves asking them 4 questions. If we could have everyone who steps into the hospital for whatever ailment asked about TB, we'll probably be mopping up pockets of TB. We need to be able to screen populations such as the urban poor systematically to mop up TB in such places. We need to be able to carry out high quality screening amongst people living with HIV, because the greatest risk factor for TB in this part of the world is HIV. We need to have the systems to allow medicine, which I'm glad to say we do, to allow medicine to move around the country. We need to have high quality diagnostics, and by that I mean diagnostics that are very sensitive, that have the ability to pick up who has disease and who doesn't. And finally, with all of that, we need to have the transportation network to ferry around samples if need be.
So what we need in Malawi to control TB is actually a people that is very willing to understand that it's time to end TB. Know your TB status. If everyone in Malawi had the heart and the urge to know their TB status, and they move to health facilities, they move to health workers and demand the TB test once every year, we could quickly reduce the problem of TB in Malawi. What we should know is that the biggest problem in the world as of today about TB is that there is a large pool of infected people who at any one time, each one of them could develop into active TB. Now we need to deal with this large pool of people. Close to 1 billion people infected. It's a big, large pool of people. What do we deal with this? That's why my colleague said it's a battle, because at any one time, this large pool can develop active TB. And if they do, we need people that should quickly go to hospitals, go to facilities, go to health workers, and access the services. The fight for TB in Malawi cannot be done as a single disease. The fight for TB in Malawi, we need to fight TB from all angles. The first angle, we cannot fight TB without fighting HIV, because HIV is the biggest driver for TB in Malawi. Of all the people that have TB, 50% of them are HIV positive, and therefore doing something on the HIV side will automatically improve on TB status in Malawi. And therefore, we also urge people not only to think of TB, but also to think of HIV every time they go to hospital. And that those people that are found HIV positive should be treated immediately. In Malawi, HIV is, once you are found positive, get treatment. Don't wait for you to get sick. So someone can get HIV test, TB test immediately in Malawi, and that is offered. And on this World TB Day, this is our message. Get to know your TB status. Get to know your HIV status.
Responsibilities on both sides. People need to be responsible for their own health and quickly seek services if they feel sick. On the side of us who provide those services, we have to make sure they're available.